My name is Ben Cowie. I'm an infectious diseases physician at the Royal Melbourne Hospital and an epidemiologist working at the Victorian Infectious Diseases Reference Laboratory at the Peter Doherty Institute. I undertake public health research related to hepatitis B particularly, and I'm involved in clinical management of the needs of people living with chronic viral hepatitis. One of my main concerns regarding viral hepatitis is the lack of health service access all the way through the spectrum, from failure to diagnose people living with viral hepatitis through to failure to provide adequate primary and tertiary level care, and the very low numbers of people currently being treated for chronic viral hepatitis in Australia. I was honoured when I was first asked to become a hepatitis hero, actually. For me, it's my patients particularly, but other people living with hepatitis who are the real heroes. I think that the reason I was asked initially was particularly around the research we've done in hepatitis B, trying to determine what the true burden of hepatitis B is in Australia, and trying to figure out ways from a policy environment at the clinical level and essentially in developing a healthy public health response to hepatitis B. We've published quite a few papers in this area and conducted a significant amount of research, which has led us to the understanding that there's more than 220,000 people living with hepatitis B in Australia, and that only just over half of those people have been diagnosed. So over 100,000 Australians living with hepatitis B don't even know they've got the condition. Now that's a significant issue for them and for their healthcare, but this is a communicable condition, and the idea that we are not giving those people information that allows them to make choices about their own health, but also protect others with whom they come in contact, and particularly household and sexual partners, to protect them from infection through vaccination, for instance, is a real failing at a public health level. We also know that of people living with hepatitis B in Australia, only around 5% are currently receiving antiviral treatment. And the most conservative estimates are that 3 times this proportion should be to prevent progressive liver disease and liver cancer. This comes at a time when we've recognised that liver cancer is the fastest increasing cause of cancer death in this country, and that hepatitis B and hepatitis C together, chronic viral hepatitis, is the leading cause of liver cancer in Australia. I think the important message for me, and one that I would like to share, is that these statistics can be changed. We can make a real difference here, and that's the core focus for me of Hep Heroes, is to make a difference. So for people who are watching this who might be concerned they could have hepatitis B or hepatitis C, the first step is to go and talk with your doctor, talk with your GP, explain your concerns, and to ask for a test. The tests are readily available on Medicare. They're a routine blood test, and your doctor can explain it with you and take you through it. And of course, another fantastic place to go for information is Hepatitis Victoria. There's the helpline and also the Hepatitis Victoria website with plenty of information about being tested for hepatitis B or hepatitis C and explaining what the results mean in an accessible format.